Good evening, everyone. We are starting our program. Good evening, and I welcome you all to this session on awareness on breast cancer by Dr. ASAVARI RAUT. The month of October is the Breast Cancer Awareness Month, and it is an annual campaign which is done on every year to create awareness on breast cancer and to raise funds for the breast cancer related researches and for its cure. The Women Empowerment Cell of our Malabar Dental College is also becoming a part of Breast Cancer Awareness Month by conducting this online session on breast cancer awareness by Dr. ASAVARI RAUT. Without much further ado, I invite our principal, Dr. Meenu Mary C. Paul, to welcome everyone. Over to you, ma'am.
Very warm good evening to all who have come for this program. I'm extremely happy to see 88 participants and most of it are my own students, so very happy. Boys are there, girls are there, very happy. Anyway, I'd like to thank our special invitee, our speaker, Dr. ASAVARI RAUT, for sparing her time for this session. I welcome you, ma'am, to this session. And special thanks to Sapna.
Thank you, ma'am.
Special thanks to Sapna, ma'am, for arranging this session. As you all know, and as Dr. Suti said, October is the Pink October. It is the Breast Cancer Awareness Month, and it is for the awareness, to create awareness about the impact of breast cancer, because that is the most common cancer among women worldwide. And awareness is very important because it can save many lives if detected in the early stages of the cancer, so that subsequent treatment will result in a better outcome for the individual. And I'd like to congratulate the Women Empowerment Cell of Malabar Dental College for organizing this Zoom meet. Not taking much of the time. Thank you one and all. Once again, special thanks to all who have assembled here, especially our Vice Chairperson ma'am is there, Gigi sir is there, Chitra ma'am is there, everyone. Who else? Anyways, welcoming everyone. And now it's 92. Very happy to see 92 participants. Thank you one and all.
Thank you so much, ma'am. Now I invite our dear Vice Chairperson and the Chairperson of Women Empowerment Cell, Ms. Samira ma'am, to share a few thoughts with us. Over to you, ma'am.
Thank you. Good evening, everyone. As Meenu ma'am told, the strength is 94. Of course, Women Empowerment Cell is doing men as well, I think, to give us support and encouragement. I could see Gigi Don sir and many more maybe. So happy, and of course it's the October Pink month. I somehow managed to get into a pink dress. Then and breast cancer awareness. We all know that it's not just for the month or just for a one-day thing. We have to be aware the whole life, especially maybe after your 30s. It is an awareness that we should have, and we should spread to others, all the elders of the family. Maybe our students, they might be thinking they are too young to think about this. Of course, they have their aunties, their parents, everyone. And we all know the early detection is the first thing. We need to do the monitoring and other parts. And we have to educate the people who are around us and to be aware of it, not to be worried or not to forget it or to be scared or something. We have to be aware and how to treat it when the early detection and all the other things. I myself had undergone the mammogram test recently because I'm in my early 40s. So I thought I should be doing it. So in this way, I say all my fellow beings over here should do, even though the procedure was a little bit embarrassing and not very painful, but still, health is more important, all these factors and these factors. So I myself did it 2 months back. And I strongly encourage each woman to get this mammogram done. I'm so happy, and please share this awareness to all, and not just in a in a day or a week or month throughout their lives. Thank you so much.
Thank you, ma'am. Now I invite Dr. Sapna Bhaskaran, our convener, Women Empowerment Cell and HOD Department of Prosthodontics, to introduce our speaker for the day. Over to you, ma'am.
Warm good evening to our respected Vice Chairperson, Principal, HODs, staff, and students. I'm extremely overwhelmed to introduce our speaker, a close buddy of mine, Dr. ASAVARI RAUT. Just a minute, I think it's echo. Yeah. She is a clinical pharmacy specialist, heading the Department of Pharmacy Practice, PharmD program, Bharati Vidyapeeth, Pune College of Pharmacy. She has 18 years plus years of academic, clinical, and research experience. She has more than 40 international and national research article publications. She has secured the prestigious Dr. UK Shade Award for the best paper at the American College of Clinical Pharmacology. She is involved in NABH activities of Bharati Hospital, has taken the initiative for setting the AICT Unnat Bharat Abhiyan sponsored project for poisoning management challenges in rural Maharashtra. She has also been a coordinator and resource person for AICT sponsored QIPs, national conference, symposia, and continuing pharmacy education. She has delivered more than 50 guest lectures on various areas of her expertise like rational use of statins, antibiotics, methotrexate intolerance in rheumatoid arthritis, efficacy of newer DMRDs in musculoskeletal disorders, toxicological and analytical research. She has also been an active in preventive health screenings conducted in vulnerable population like oral and breast cancer screenings and creating awareness in society regarding the risks associated and early identification of signs of disease. So with great pleasure, we the Malabar Dental family welcome you. Over to you, ASAVARI.
Thank you, Dr. Sapna. Thank you. Okay, can I take over?
Yes, ma'am.
Thank you. Thank you. I'm sorry I couldn't get your name on screen. It is just Malabar Dental College. Can I know your name, please?
Yes, ma'am. I'm Dr.
Yeah,
Shruti.
Shruti. Okay. Dr. Shruti, wonderful job. A very warm welcome you have given me. So feeling very privileged as well. Special thanks to the Vice Chairman, Madam. Very beautiful lady in pink. Ma'am, it is good to be connected with you virtually. Yeah, I thought that probably it would have been a better platform if we would have connected physically, if interact physically. But anyways, at least we are being connected virtually, so that is fine. And she has very well highlighted regarding the screenings and the thing that is done by herself. So it's a great message to start off with. So I'd like to congratulate Madam for that, because a lady leading from the front is always a very positive thing for the others to get inspired. Thank you, Principal Madam. Very warm welcome from your side, and I'm very happy to get associated with you all. So I hope that this session of ours will be a little helpful. So I would like to take it as an interactive session itself. So we can take it further. And these types of talks actually I used to give very frequently. And Sapna and I, when we used to actually converse, then every now and then she was like, "Are you're giving all these talks everywhere?" So that kind of the conversation it actually started with. So when she got to know about this, we had not conversed about the cancer screenings, what actually I undertake very frequently from my department to the various communities. So this is how actually she got to know, and then she gave me today an late hour job, ma'am. This is what I want to tell you, Principal ma'am and Vice Chairman ma'am. Today she has given me an extended time, and I am in my office today post my working hours, And anyways, a very happy moment because I could connect with you all people today with this very brief kind of introduction from both of us. Kindly allow me to share my screen.
Yes, ma'am. I've already made you co-host, so you can share it now.
Okay. Okay. Okay, is it visible to all of you?
Yes, ma'am. Yes.
Okay,
We can
thank
see.
you.
Yeah. Yes.
Okay, fine. So coming to the breast cancer, as it is told in the introduction that it is a vital thing for all of us to know regarding any types of cancer for that matter. Now we should understand one thing, that whenever we think, whenever even we hear this term cancer, it is never a pleasant word to us. It is really a dreadful kind of a disease which first creates the scare and fear in the minds of the people. So we have to understand this one thing, that the term itself, when it is so scary, when it is so fearful, then no one wants to know about it. And considering or thinking themselves that they might get this, or they might, get this particular disease, is out of the imagination. Probably this is the reason why in countries like India, we people are having a very less kind of inclination towards preventative health measures than compared to the ones that the disease is already getting diagnosed and then the person is going for the treatment of it. So this is the reason why breast cancer actually becomes important for us to know that it is something which is involved with a lot of pain, agony, and it changes the course of the time, for the course of the life for worst, basically. So this is the reason why we are not given inclination, and forget about the common community, the layman. But we learned people, even we healthcare workers who are working on the front line in the hospitals, even many of us are not aware regarding the prevalence, the risk factors, the self-assessment, the self-breast examination. These things are really not coming into our purview. So this is the reason why it is very important for us to know, and that is the reason why I congratulate Malabar Dental College for taking this topic as one of the focus points in this particular month. So when we are actually making such a who and high regarding breast cancer, we should know that why it is suddenly becoming so very important for us to feel scared about. For this, we should understand certain statistics. If we look at the statistics which is given by Globocon in 2020, breast cancer is one of the most common diagnosed cancer in India. So you can see that around 13.5, it means almost 14% of the patients are being diagnosed with breast cancer annually. And this is important that it is annually. And this particular percentage is actually on the gradual rise. If we look at different type of the cancers in India, then earlier it used to be the cervical cancer, the lip and the oral cancer. These were the different types of the cancers that were on the rise. But subsequently, in the recent years, we can see that breast cancer is like coming up very slowly and steadily, but it is actually taking up a very fast ride. So this is what keeps us on the alarm, that why breast cancer is taking such a lead. Why is that every percentage of one particular community is getting affected with this particular type of the cancers. So if we compare our statistics with the global statistics, definitely we are now able to make a clear-cut instance that the incidence as well as prevalence is more in India than even compared to the worldwide. Now, if we consider only females, which type of cancers are more prevalent in females? Then, as I told you, that cervical cancers used to be really at the very highest risk. You know, they were the first type of the cancers which were seen earlier stages in India. But now, as I told you, that the breast cancers are taking on the rise. Now, to tell you the very recent development, that's what I was actually going through the clinical trials website, the clinical trials .india.gov. We have one more alarming thing which is happening, and that is the oral cancers coming in rise in females, and this is a very important kind of observation that has been noticed. But to show it as a significant percentage, we have to wait for some time, maybe 4 or 5 years of census, and then we will be able to come to know that the exact prevalence of the oral cancers is also more higher. So tomorrow, unfortunately, it can be one of the things like breast cancer and oral cancer in females can be in one of the competitions. So that can be there. Of course, it is not healthy. It is not something that, we should be looking forward to that. So definitely not. But it is important that we should be aware what exactly is happening around. Having said so, it is important of one more thing, and that is we should know that if it is happening globally, if it is happening in India, if it is coming in rise in India, we should also know what is happening around us. When we talk about epidemiology, for example, we say that in US that much is the raise. We take US always as the standard point in case of disease occurrence, or in case of economy, or in case of the newer drugs that are coming up, the developments in the health sciences. But in case of it is very important for us to know what exactly is happening around us in India. Even in India, we know that region-wise we are distributed and we are scattered geographically, the north, south, east, west. So we have to understand, if I'm there in this western part of Maharashtra, what is happening around me? What is the prevalence and status around me? Similarly, if you people are sitting there in Kerala, it can be this is what the survey has been found in the distribution of this 5-year age duration of the distribution of the cancer. You can see that we are having all these metropolitan cities on the rise for the breast cancer, and you can see on the place number 4th is Trivandrum. So there we can find again 28.5% of the incidence of the breast cancer. So it is very important in my own region what is happening, not only in my country but in my own state and region, what is the incidence. So when we know that it is actually spreading around me, then I should be always knowing then it can be risky to me as well, because if it is spreading so fast, then definitely it has to be a self-concern kind of a point. Now, one more area regarding these cancers, when they are actually prevailing in the society, then cancers, as I told you, it's dreadful, it's fearful. So what actually happens if there is this particular kind of the cancers in people? So we should know the outcome of it. What exactly happens after that? Do people die? And if it is so, then we should be knowing the mortality rate. So in case of the mortality rate, every year, should to say, approximately around 90,500 females, women in India die because of breast cancer, and which makes it, a percentage, a significant percentage, to 10.6% of all the cancers, which actually are being mortal. In that, the breast cancer is one of them. Now, if we look at the statistics again, compared to that of the global as well as Indian, you can see that in India, the incidence, the risk factor, the mortality has been quite higher than compared to the global incidence. It makes this more scary. It's an alarming thing for the Indian women to know that in India, the mortality rate has been comparatively higher. We will know why exactly it has been so. The graph which you can see at the bottom, you can see that the breast cancer mortality has been comparatively higher than compared to the other types of the cancers. Now, why is that the breast cancer is being burdened in India, and what exactly is the Indian scenario we people are facing in? First of all, there is increased incidence, prevalence, and mortality. That is what I have already shown you through the statistics, through all these published medical articles from various clinical trials websites and the medical bulletins. This is what we have understood, that the increased incidence, prevalence, and mortality has been higher. Then one more thing is, as I told you, that breast cancer is taking a very huge heap. It is surpassing all the different types of the cancers. So that is going to be second one alarming point. One more very important part, and probably that is the reason why we people are all connected today, that is the diagnosis of the breast cancer. When is it getting diagnosed? So this point is very important for us, that this disease is being staged, or it is being diagnosed on stage 3 and stage 4. So the part which we have to understand is that why not stage 1 and why not stage 2? So it is very important. Now, why it is not coming, or why it is not coming into the picture in the earlier stages of the cancer, is simply because of unawareness. It's simply because of unawareness. It is simply because of no symptoms in the patients, and or the symptoms the person doesn't know. That is very important. I would like to bring one point to the highlight, which probably most of you people will connect with me. When we girls are being brought up in our families, in Indian families, we have been told something about, we have been taught rather very wrongly, something about pain and the bearing about the pain. Now, we all know when we actually reached puberty, when we all actually started menstruating, I still remember my mom saying, when I used to cry, when I used to get those very terrible cramps and when I used to cry, my mom used to always say, no, beta, this happens. You have to bear. You have to bear. You are a girl now. This happens. You have to bear. So some types of these particular pains, and this is told to you because you are a female, because you are a girl, because you are like this. So you need to bear. So we are actually brought up in this particular manner that for us, pain becomes the integral part of it. Actually, this becomes a lifelong message for us to carry, that certain types of the health ailments for us is with pain. And I feel that most of you people will be agreeing with me that during our college days, when we entered into college, many of the times we were not even allowed to take analgesic pills. Schools, though, it is really a very different case. We were never even accessible to any type of the analgesics or so. Even in the college days, I remember we used to, sometimes used to feel dizzy, collapse down. So, all these things used to happen, but we have never been, that pain has not been addressed by in a technical manner in which it has to. So growing along with that, it makes a little part which actually it is reflecting here in such type of the diseases. When we see the early signs or early incidents of this particular disease in the body, most of the times, unfortunately, it does not have any signs. It does not have any symptoms. When I will start telling you regarding what are the exact signs and symptoms of breast cancer, you will be surprised to know that any type of such changes which are actually happening in these types of the cancer usually happen in the later stages. That is when the disease has already crossed the first phase or the second phase. And that is the most unfortunate part. So it is very important that the person should be knowing what is normal, what is abnormal, how I should understand my abnormality. So this is a very important part for us, for all of us to know. This is the reason why in India, the diagnosis has been a little late. So and when we I told you that when the frontline healthcare workers, the doctors, the residents, the interns, many of the times when we actually survey them, when we actually have interaction with them in the hospital, I have seen that most of them, they are not aware regarding this particular course of the disease. And this is the reason why the women are really not aware. When this is the condition in the urban locality, you can understand what might be the condition in the rural areas. So we call this particular type of the cancer in the beginning stages or in the earlier stages as silent cancer. That is simply because of lack of awareness. Another one thing is, again, in US scenario, when we actually today, we are very beautifully dressed today in pink, and we are here. So at least through this particular pink, there goes a message that it denotes what are we actually focusing for today, or what it is actually indicating for. In all the Western countries, they have this as a ritual, that which type of the disease and which are the most prone population, which needs to be screened. The screening healthcare programs in India has been very, very, very low. Comparatively, it is completely lower. There is no administrative hold on actually such type of the preventative diseases. Today, government is taking a lot of, it takes efforts for the programs like malaria, for tuberculosis, and everything of this sort. But then the screening programs, which actually are costly, which require a certain amount of this particular funds to be actually released by the government. So these type of the preventative programs of screening, they are really on the low. And this is the reason why, as I told you again, the urban population itself also do not know whether such type of screening programs do exist, and if they do exist, then where do they exist? They do not know where exactly they have to enroll themselves for. And last very important part in case of this Indian scenario is that the ratio of the patients and the oncologist. So you can see 2,000 oncologists per 10 million patients is really a very, very small number of that particular ratio, which is actually attending this particular type of the patients. The oncologists are really very low in this particular part. Now, general medicine has got its own limitations. Gynecology has got its own limitations. The surgery has got its own type of limitations wherein to address the interventional treatment for this particular type of the breast cancers. So the number of the oncologists which actually are present in Indian scenario are comparatively again very weaker or lesser. Next, we will see why exactly is the survival in India is low. So this is as directly proportional as I already told you. Awareness is less. People who come to the, even who come to focus on what exactly they are facing is on the later stages, and because of which it is going to be already in the advanced stage. And to reverse that particular condition is going to be really very difficult. That is the reason why the survival has been late. And another one is the advanced stage, as I told you, the time it gets noticed, the typical signs of breast cancers, when they actually get it noticed, it might have already crossed the second stage, or the disease might be in the advanced second stage of the cancer. And every time we do say that, cancer is nothing but it's a lump or a swelling or bleeding or anything of this sort. But actually, even to you just look at the shape and the mass of the breast. In that itself, it becomes so very difficult to identify that particular lump. And imagine the lump will not be really very big, that you just touch it and you will feel it. No, you don't feel it that way. The small one, when it starts, it is really very difficult to actually even find and see. Even when we actually cause this, create these awareness kind of things in our own female community, to even examine that particular breast, it has got to be having some practice. A person cannot make out things right in the beginning or the first examination. You have to have repeated examinations of yourselves. Many of the times when we call these particular at-risk patients, I will in my coming slides, I will let you know what exactly are the at-risk patients. But when they come, we actually make them feel those particular type of the breasts in which the small lumps are there, in which palpable lumps are there. So even we make them feel that, so that they will know what exactly they need to screen in their own breasts. So that is also very important. But how many of such communities actually accessible to such type of the facilities in the hospital? So this is what I told you, that the signs and symptoms, the visible lump or lump in the breast, inside the breast. Then we have something like a dimpled or the depressed kind of the breast, wherein the skin, you can see a skin depression in one of the breast. So there is no firmness of it. There might be swelling. There might be inversion of the nipple from outwards to inward, that is inversion. Then one classic sign of the cancer is the pain. So pain is there, and then it is something like skin irritation or the itching or textural changes. Again, as I told you, it's a wrinkly kind of the skin on the breast, and it might be only on the one kind of the breast and not both. And next one is going to be bloody discharge. These are the classic signs. These are such signs which when they come into the picture, it means that the person is straight away supposedly be going for the diagnosis of this particular breast cancer. Let's come to a very important part in which we all people, we are actually looking forward to, and we all should be knowing about it, that which are the risk factors that are associated and whether I'm coming in that particular risk. So today, at the end of my talk, I'm also going to tell you something regarding how to assess our own risk, how to know that whether I'm coming into that risk category and what is making me to come into that risk category. So the risk factors in general, they are age, increasing age, genes, the family history, radiation exposure, whether the body has been exposed to any kind of the radiations in the past, especially on the chest area, the dense breast tissue, obesity, alcohol consumption, gender, personal history of the breast cancer, early menstruation, late menopause, having the first child in the, at what particular age. Then the next is the nulliparous or never pregnant patients, and then we have something which is called as the hormonal therapy. Now, actually today, very only during the talk or during the inception of this particular talk, I got to know that there are some male participants as well. So I actually had no idea of this. Otherwise, then I would have little bit added some of the points that were even important for the males to know. But anyways, I think we will go with the majority. And since it is to the ladies and to the girls, let's address their own problems first. So first we will see how actually the age becomes the important risk factor for this particular breast cancer. The increasing age or the increase in the age becomes the biggest risk factor, simply for the reason that the cell starts, getting damaged, as the deterioration of this particular age takes place. So the genetic damage is more. So the mutations of the cells take place. And this particular mutation, what it does is the healthy cells which are going to be there, they are going to have one particular body's self-defense mechanism, which we call it as a self-repair of the body. So there are some proteins which are in the body, which will actually create or make certain proteins which will protect the DNAs from damaging. Okay, it's a self-defense of the body. So once this particular mutations takes place, which is very evident in the increasing age, that these mutated cells, they start becoming themselves cancerous, because now they are not in the protective phase, but they are into the damaging, the more damaging to the genetic cells to take place. So age is going to be one of them. More than half of the type of the cancers, breast cancers, actually they come in the females who are 50 to 69 years of age. It means that the menopause. So during the phase of the menopause, that becomes very, very important. The reason for this is again very simple. The body is in the deterioration phase. The mutation is taking place. There is no formation of the new cells, and the genetic damage in the cells is being on the rise, on the high. And when the spreading of this particular, or when the mutation of the cells take place rapidly, it means that the disease will be evident in this particular type of the population. So this becomes prone to. Next one is, as Madam already told in the beginning, Vice Chairman Madam said that since when we come to 40, we need to do ourselves for the mammography. Now, there is two things which I would like to tell you. In our hospitals, when we do in the practice, we know that a certain chunk of the females, they are having this particular risk well before the age, maybe late 20s, maybe early 30s. The females who have got married very recently, even though those people have this particular problem. So, of course, again, assessing at the risk, that also will come later. But now, there is one thing for mammography. Mammography is never done to the females who are below 40 years of age. They need to be having above 40 years of age, then only they will be able to go for mammography. Now, the thing is, there is now contradiction. Now, whether, if it not diagnosed, if not mammography, if it is not done in the earlier stage, then definitely the disease will be again in the advanced stages. So what is the status of those particular females who are below 40 years of age and they are not able to diagnose? So in these conditions, the risk assessment and the history of that particular patient becomes very important and very evident. And such females need to be associated or enrolled themselves into this particular breast cancer awareness, irrespective of their age. And after that, in which the physicians or the oncologist, they basically make a protocol at which all particular time intervals the female will be undergoing mammography. So under such circumstances, when the risk of the female is higher, when even if the age is less, but the risk is higher, the family history is strong, such females will be taken for the mammography irrespective of their age. So even below 40 years of age of females can also go for this particular type of the mammography. So this is what has been one of the contradictions. Those females who have been diagnosed with the breast cancer at the early stage of their life, unfortunately, they have very less survival rate in the life, right? So that is one of the correlation. That is what we have found it scientifically. Secondly, it doesn't mean that the earlier the diagnosis, maybe the self life will be increased. No, probably the quality of life will be modified. That will be better with better type of the medical interventions which have actually come up now. There are advanced type of the treatments which have actually come up. So this is for those particular type of the women who are actually diagnosed in the earlier stage of the life of their age. Now the prognosis tends to be worse for women under 40 than the older women. This is the only contradiction part, that even if the female is doing all right from her end, she is screened herself at time, she is assessed herself for the risk factors, she has taken up her risk factors or the family history, and after taking up all this, when she's been actually diagnosed with a breast cancer in the early stage of life, but unfortunately these are those few types of the cancers which actually the patient cannot reverse. Unfortunately she cannot reverse, and the survival rates become actually doubled, or it is more risky for the patients to have a disease-free life. This is what I call disease-free life. Another one is BMI, the body mass index. How much role that has got to play in this particular type of the breast cancer. So it's a bit obvious, being fat is actually absolutely not a good sign in any of the things. Whether it is cardiovascular diseases, you take metabolic diseases, all the diseases are at most worsening and the risky factors when compared to the survival rates or the health of the female, except for cardiovascular diseases. I would say that before menopause, the female hormones are the one which are actually protective towards the cardiovascular diseases, and that's the reason why the cardiac failures and the heart diseases are comparatively lesser in women before menopause than compared to any other type of the disease. So in case of body mass index, if the female is having a higher body mass index, more than 30 of the BMI per kg, this particular condition is the one which is putting the female more at the risk, right? So the fat cells, the more in the body, it simply means that fat cells are the ones which also produce this female hormone, which is called as estrogen. Estrogen is the one which is actually causing, it is directly correlated with the cancers. So this particular estrogen, what it tries to do is, estrogen usually it multiplies, it helps the multiplication of the cancerous cells in a very, very faster manner. It brings about this particular mutations very, very faster, and that is the reason why estrogens, we do not want this particular type of the levels are high. With the same regard, I would like to continue the discussion further on this line itself. There are two aspects. When are the estrogen levels high? We know that there are these there are contraceptive pills, or there are these birth control pills. There are emergency pills that the females will be taking every now and then. And in this present urbanization, in the change of the lifestyle which is happening around the society, we know that our youth is turning towards things which are completely away from the nature. We are going from the natural lifestyle what we used to have earlier. So if this is a kind of a thing, and if the female every now and then, if she is giving such hike of these estrogen levels in the body, she is putting her body in the risk of mutating. And that's the reason why even the normal cells can mutate, and that mutation will lead to the cancer or will lead to the breast cancer. So the BMI, the estrogen levels in these particular type of the people or the patients, that can be dangerous for causing the breast cancer in these patients. So that's what I told you, that the same thing will apply to the menstrual cycle. So the person who starts menstruating in the earlier stage will be at more risk, and the person who actually takes menopause a little later, in the later stages of the life, simply means estrogen is the exposure of it is prolonged in the body, and that's the reason why the female's cells become more riskier at the risk of the mutation. So having said so, does that affect normal cells? No, it does not affect normal cells. It affects only the cells of those particular females who are at certain level of the risk. So it will be all dangerous, or it will be created, that this particular mutation of the cells will be created into a disease if the risk factors are associated with that particular body. So this is the reason why there should be preventive measures, there should be awareness, and there should be who should be taking what particular type of the pills. That is also becomes very, very important for such type of the cancers. When we come to the pregnancy, we know that the full-term pregnancy is usually the one which actually has got the decreased risk in case of breast cancer, and the earlier the better. This is what it is said, that the female, if gets married at the earlier stage of the life, early means not, I don't mean really a child marriage, but early stage of the life, that is near around 20s or in the early 20s, and the female gets pregnant, a full-term pregnancy, and she gives birth to that particular child and starts breastfeeding to that particular child, it means that this particular risk of breast cancer, it actually minimizes or reduces in this particular female. But this same thing, if the pregnancy is prolonged after the age of 30, so then that increases the risk. Secondly, no breastfeeding to the child, it doubly increases the risk of the breast cancer. So this is what the evidences we people have presently. And secondly, also the nulliparous females, the females who do not have children, she will be at the threefold more risk for developing the breast cancer. This is what the recent studies have been telling us. let's understand what are these genes which are actually associated with the breast cancer. So BRCA1 and BRCA2 are nothing but the breast cancer gene types 1, gene type 2, BRCA1 and BRCA2. So what do these particular genes do is, usually these genes are beneficial genes. They are the genes which are helping the body to heal, to self-recoup, to repair those particular type of the DNAs which are undergoing damaging. So in normal circumstances, these particular genes will help you in preventing or stopping the genetic damage to the DNA. But at the same time, if these particular cells, they become mutating, and when they start mutating, at the late stages of life, in the later stages of the life. So when they start actually mutating and they leave their normal status and they go to the late stage, in the stage of mutating, the same preventive and beneficial genes, they start becoming harmful. They start becoming cancerous, and they start causing cancers in the females. So this is what is actually the BRCA1 and BRCA2 has to play a role with. History taking, family history, and different types of the cancers, it is really a very vital part. So even to my clinical pharmacist interns, when they are there in the hospital, usually this history taking, I take it very, very seriously. And both the medical department and our own department, we have different protocols. We have different history formats in which we go in depth of finding out that what exactly can be the risk in the patients. So let's understand, in case of the family history, there are two types. One is going to be the first blood relationship, and then we have the second blood relationship. The first is very, very obvious. That is the exact genetics. This is the mother, from the mother to the children, even the sister, the own sister. So this type of the relation is the one, the first degree. And if anybody is having the cancer in the family, then that person becomes at-risk person for developing the breast cancer. So it does not mean that the person who is having breast cancer history in the second relation of the family, that person does not come at risk. No, we are not actually taking off any particular kind of, because there is the correlation scientifically that's seen, and the correlation that we actually find it in our real world, in actual world, what is happening. We have seen that the aunt had got the cancer, aunt's daughter did not have a cancer, mother has no cancer, but the daughter has the cancer. So the linkage of these particular genes, there is a correlation of all this. This is the reason why we should be very, very, upfront in knowing what exactly are the genes that are being carried by me. So it is important for that thorough history or the detailed history of my family itself. Secondly, it is also important that what has been the stage of cancer. We have seen, even in my hospital, I have seen certain cases. I think a couple of cases I've seen when the mother got cancer in a very early stage of life. Her elder daughter also got the cancer in the early stage of life. And then there was this female who got hospitalized in our hospital. She also got cancer in the early stage of life. That is, she got the cancer at around 28 years of age when she was actually newly married. So when her history we saw, then we got to know that the mother couldn't survive beyond 47 or 48 years of age. The sister also was almost in the stage 4 cancer when the sister was in her late 30s. So here we get an idea, there is a prediction that what type of the mutations are there in these particular types of the patients. So history plays a very important role along with the other risk factors. That is what it has to be known about. So as I told you that lactation is one thing which is very important part, that it can be sometimes preventative for the prevention of the breast cancer in patients. There is one thing which happens during pregnancy and breastfeeding, and that is the shedding of the breast tissue. So when this shedding of the breast tissue takes place, the removal of the cells, and the removal of the cells means basically it's a repair. The damaged cells are getting removed from the body by a very natural process. This is what can happen, and this is the reason why breast feeding is supposedly be a protective measure for that particular person or the patient. One more thing we need to understand now, there are certain myths and facts. We people all know about it. There are these breast development clinics, at the same time the breast reduction clinics you might have come across. So there is a myth amongst female that the larger breast size may cause cancer. No, it doesn't. It is not that evident. We have to understand what exactly is the breast made of actually. The breast is made up of 3 types of the cells. One is the normal fat cells, the fatty tissue. another one is a fibrous tissue, and third one is something which is glandular, which actually is secreting, the milk. So the glandular tissue. So for the person to develop the breast cancer, it is not about the size of the breast, it is about the density of the breast, the number of the cells, and that too, the glandular cells and the fibrous tissue is the one which play a very important role in the development of the cancer, and it has got nothing to do with the volume or the size of the breast. So thinking that there is again one more, even in my own community, in my own people amongst my medical residents, I've heard this saying that if someone has got a larger breast, then she might, because again after marriage and after pregnancy, she may again increase the size in the breast, and that is the reason why she may be prone for developing breast cancer. But that is actually a myth. It is not like that. It is all about the density, and the density is very, very important. Having said so, we have to understand one more thing. What is the challenge, or what is that contradiction which can happen in diagnosis of cancer? Now, as I told you, the tumor size is so small, and the glands in the breast are also, so you can feel them in such a way that to differentiate between a glandular cell and then the tumor small cell, it becomes again very difficult. So sometimes the dense kind of the breast, in the early breast examination, self-examination, that might not be giving a clear idea regarding whether the person might be having a lump, or if the lump is there, whether it is a palpable lump. So this is what can happen in the earlier stages of this particular dense breast. So this is very important, and women with dense breasts on mammograms have higher risk of breast cancer than women with compared to the average of the breast density. So this is what is told about. Now coming to the lifestyle, modern era, modern days, the youth going to the modernization, unnecessary exposure to different type of things in the early stage of the life. So many of the times we've heard, we have learned, we have known many of the medical articles that sometimes the red wine can be better, stress reliever, or all these kind of the correlations are there, right? So in case of cancers, it definitely does not hold good. So any type of the alcohol consumption makes that particular female prone for developing the cancer. So even 2 to 3 drinks a day, it has been seen to be associated with 20% of the higher risk for developing the breast cancer. So one more correlation which we have found, that alcohol can even raise the estrogen levels in the body, and that is the reason why alcohol consumption and breast cancer incidence that have been found correlated with. Similarly, smoking is the one, actually this is something like these particular breast cancer genes, the carrier genes which are there, they are very, very sensitive to the effects of carcinogens, which is actually induced by the cigarette smoke. So that is the reason why the smoke and the cancer relation is very, very closer, and a similar thing happens with the breast cancer as well. Now coming to the diet, the more vegan the better, the more plant consumption the better, the better natural consumptions what we take from the nature is actually acceptable, and that is the reason why the typically diet of the plant-based and low in fat, that is polyunsaturated fat and saturated fat, this is the one which is supposedly be a preventative thing for the development of the cancer than compared to the high fat diets. And high fat diets are again correlated directly with your overweight and obesity. This is what we know, and that becomes a straight away risk factor for the breast cancer. So overweight women are thought to be higher at the risk of breast cancer than compared to the any other types. But we have to understand one thing. We have been seeing about all these different types of the risk factors, right? So does it mean that the person who is a vegetarian, who is maintaining a very good weight, who is maintaining a very good lifestyle, whether she is free from cancer, may not be completely true. We have to go again with the history of that particular patient, and if the history says it is clear, then maybe 99% of the times the person may not end up with a cancer. But if the risk in the family is there, if the history says, then whatever lifestyle is being adopted in the healthier types, it can simply prolong that particular disease for a little more duration of the time, but the person does not become free from the incidence of the cancer. This is what we people have seen in the practice scenario. So the radiation exposure, especially on the chest area. This is very important. Again, there is one more correlation in the Indian society, like when we are actually wearing our clothes, and especially the salwar kameez, whatever we people are wearing, we all have these dupattas, and dupattas are the one which are taken right over our chest area, right, covering this particular chest area. So this is one of the scientific reasons, that is the area. Because any kind of the harmful rays that actually gets exposed, this will be more prone for developing certain kinds of the diseases. And radiation has got a direct correlation with the cancer. So these types, which we have seen in the recent times as well, even in this particular type of preventative health measures, wherein yearly the person goes for screening in the hospitals. So sometimes it is like, there is this 2D echo in my package, health package. That's why I'm getting it done. Why to waste the money? So that kind of the concept should not be there. This is simply like exposing without being at the potential risk of the heart disease. If I'm going and exposing myself to these particular type of the radiations every now and then, I'm putting myself at the risk. So it is very important that we should be knowing that what type of the rays are the one which are going to be. So one more scientific correlation, what we actually have to know is that if the same radiation therapy is given to radiation exposure is being given to the female who is above 40 years of age, then that she might not be at that particular type of the risk than compared to the female who is getting exposure to the radiations in the earlier stages of her life. So that is also important correlation. Next one is going to be again the hormone exposure therapy. So we have this something which we call it as menopausal hormone therapy, that is the MHT. So the conditions like osteoporosis, post-menopause, we give hormone therapy to the females, the estrogens, for protecting this particular bone health. So this exposure also becomes a risk factor for the patient to develop the breast cancer. I have already touched this particular area of the birth control pills. So it is a very important message. If any of the, I've heard that there are so many students who are actually attending this lecture. So you people should be knowing that the exposure, there is something which is called as emergency, and emergency should be, emergency cannot happen on a daily basis. Emergency cannot happen on a routine basis. Emergency happens at very, certain times, and it has got to be only once or twice, probably. And if that is happening, and then if the emergency pill is being popped up, it's fine. But emergency pills are not for the planned kind of the takings. So that should not be done. And this is a risk actually. If you take the statistics of some surveyed kind of the young patients who are diagnosed with breast cancer, we know that there are so many mistakes that are done by these particular females at the early stage of their lives, by which they have exposed themselves to the breast cancer exposure. Otherwise, actually, they were not the modernization, and this is one of the very strong reason why the lifestyle changes that has been happening in the diseases, not only cancer but different types of the diseases. It has been inviting to. So this is important. We usually correlate any type of the disease with the people who are having low socioeconomic background. So the person who is living in the areas that are should to say the slum areas with no much of sanitation and everything, so they are prone to develop many kinds of the disease. But in case of breast cancer, it goes a little different. It says that the people who are coming with a high socioeconomic background, they are actually more at risk. Why? Simply because of their lifestyle, the sedentary lifestyle, the type of the food they intake, the exposure to the smoke, alcohol. So these are all the types of things because of which this becomes prone for such people to develop breast cancer. This is the reason why epidemiology, when we saw especially the epidemiology of Indian scenario, we've seen that the metropolitan cities have got higher rise in case of breast cancers than compared to the other part. So that is the reason why this particular socioeconomic status also plays an important role, and urban women are the one who are actually more risk of developing this particular type of the breast cancer. So after having known how it actually occurs, why it occurs, who are at the risk, and what are the risk factors actually. So after knowing all this, what one thing comes in our mind is, okay, we know that this is existing in this particular percentage, but then what is the prevention? How can we prevent it? Actually, prevention is a procedure to follow. Prevention cannot say that it is going to prevent you from the disease in 100%. This is important for us to understand. What prevention can do is, prevention can keep us on alert. Prevention can keep us alarmed. So we know when is the incidence, and the incidence or the identification becomes early. And when it becomes early, the treatment will be earlier. And today's treatment is so very advanced that if earlier the treatment started, then the prolongation of the life can be bigger. Moreover, if the incidence of this particular disease, if the diagnosis of this particular disease is being done at the stage 1, or even before the stage 1, the same disease can be reversal. It can be reversal. We have such type of the advanced treatments or the therapies for this particular breast cancer. So what are the preventive measures? Preventive measures, as I told you, it is nothing but it is one of the routine, or it's a procedure of examining yourselves, of understanding whether you are coming into the risk, of assessing yourself whether you are coming into any type of the risk of or the history. So these three things we will see. First one, we will see what exactly we can do is that we should regularly go for the self breast examination. This is a very, very important part, and we should be knowing that this is the only way by which I can understand, I can myself come to know the earliest stage. Because once I start getting my symptoms, and then if I end up into the doctor's clinic, I do not know in which stage I will end up into. So this is very important for me to do the self breast examination on a very, very regular basis. So the self breast examination, it has got different stages, and we have to understand that the earlier the better. The earlier we start doing the breast self examination, the better for us, because then we will be able to identify what was normal, what is being abnormal, and immediately I'll be able to attend to my abnormalities. So there are certain steps in which I will be checking myself in the mirror. So the step one is very, very easy. Just stand hands down in front of the mirror, and the best place to stand in front of the mirror is the washroom, is your own bathroom, wherein you're taking bath and you're standing in front of the mirror. That is the best place for doing the self breast examination. Hands down, step one, check for this usual size or shape and color of the breast. Okay, even the color of the nipples also need to be checked, right? So these three are the things. Now one thing is that if the person has not noticed earlier, what exactly has been the size, what exactly has been the shape or the color of the nipples, then we cannot know what is abnormal. That's the reason why I have been saying repeatedly, it has to be a regular examination, and you should be knowing what exactly is the shape, size, and color of the breast. So first examination is this, that is the usual size, shape, and color. Second one is the distortion. Distortion means if there is any change in the shape of that particular breast, shape of the breast, or the organization of the breast. Now we know the organization of the breast. Okay, so whether the drooping or the standing breast, that we know very well. Whether there is a wrinkle on the breast that has come, or there is a depression in one particular type of the breast that has come, or there is severe itching on one of the breast with some of the red marks on the breast, that also we should know. So any type of such changes will tell you that something is wrong, and of course the typical swelling. So if you see anything of these particular things, then you should be alert. And next is when it becomes very important for you to meet a physician or a doctor, and that is the dimpling or the puckering or bulging of the skin. Now what is dimpling? Dimpling is simply a line or a wrinkle that is actually coming on one of that particular surface of that particular breast. So if it is coming on that particular part, right? So if you are seeing any of such particular change or the breast which is firm everywhere, but one side you can see a wrinkle that's been falling, only just a wrinkle that's been coming up. So even that becomes a that becomes an alerting point for you to actually get it checked by the physician. So this is the one, and as I told you, the third very important part is the shape and the protrusion of that particular nipple. So the inversion itself, it's a very wrong thing. It should not happen. And if that inversion is there, then that also should be actually looking, that also should be addressed to. So that is going to be important. Other than that, we have the redness, soreness, rash, and swelling. There is one thing, like different type of the screenings when we go, then I would like to give you examples of 1 or 2 cases what I have come across. Last time when I went to a corporate office, it was the females of the research and development team whom we had actually screened for breast cancer. And there was very, when we actually started, when we were showing them, it was like a live demonstration with these particular females. So when this type of a thing which was going on, then there was one woman who came up and said that she has got this external development, external growth of we cannot say it as a, it was a nodal development, but it was on the superficial side. It was on the superficial side of that particular breast. So we asked her whether from when she is noticing or when she has actually noticed it. So it was very, this thing, she said that no, this was not there earlier, it has come now itself. So, but it was superficial. So when we had even the breast surgeon along with us, even she also, examined it, and we got to know that it has got to do nothing with the inside of the breast. The growth has not come inside of the breast, but is actually the outside of the breast. So that was one of the things, but it was again sent through the same examination procedure. It was found to be benign, and then it was self-operated from the top of it. Second one, we have something which we call it as the skin tags. Now, skin tags, they appear any part of the body, maybe neck or anywhere. There were 2 of these females who had skin tags right on the breast itself. Right? Skin tags. I hope you all people know what are skin tags. So skin tag was right on the left side of her breast. Right. So actually, when we saw the skin tags in cancer, when we take the history of those particular patients, we have come across one thing. There are some skin changes which we, and I'm not saying this only for breast cancer, for any type of the cancer rather, there will be some marks on the skin, hyperpigmentation, the typical type of those particular wrinkles or the marks that have been heavier. So this female, when she had 2 types of the skin tags, then we immediately put her for the history taking. We have sent for the history taking. In the history also, we got to know that the second relation, one person had breast cancer in the family. So that was one evidence. Next, third one is something which we do in the screening is confirmatory. In screening, we get to know whether the person is coming into the potential full maximum risk. So this female came into that particular high risk patient when we put her into that particular risk assessment scale. There are parameters by which we will be assessing whether the patient comes into it. So what I mean to say that certain things which are so very regular, which are so very routine, and we know that it can be part and parcel of our body, but it may not be. That is the reason why the smallest minute changes also, especially on the breast area, needs to be actually examined, or it should be known. So this was step 1. Now step 2 is something like in step 1, what did you do? You have just put your hands down and you have seen the changes for the breast. Now second one is raise your hands above and then examine the breast. So the same type of the volume, if it is raising upwards, when we are actually raising the hand towards that is the lower areas of the risk of the breast will be also examined for the same symptoms, for the puckering, for the dimpling. So the same things we are going to observe even after raising the hands and on the lower side of the breast. That is going to be the second one. Now, third one is very classic, any type of secretion, fluid, or any type of the, red color, bloody kind of the fluid that has been coming out. So these are the stages. That's what I told you. It never occurs in a very early stage. This is, when the patient has already undergone a lot of amount of pain, a lot of amount of, changes in even the shape and the structure of that particular breast. Maybe later this particular type of has taken place, because it simply means the multiplication of the glandular tissues in the breast, and that is the reason why the hypersecretion of these particular fluids is taking place in the breast. So that is going to be the step number 3. Step number 4 is nothing but Now you have examined yourself hands down. You have examined yourself in the standing position, arms raised upward. Now it is lying down. Lying down and then examining the breast. And when you are examining the breast, please understand one thing. Never use one particular finger because you will not be able to feel the palpability. The area needs to be high. So the first few fingers are very important. The 3 fingers are going to be very important when we are actually examining the breast. All the 3 feel together will actually tell, and the entire breast area needs to be covered region wise in the circular motion. It has to be covered in the region wise and in the circular motion. And also, after applying a little amount of the pressure, whether there is pain that is actually coming up. So these things have to be seen in stage number 4. So that is lying down. All right. So this is going to be important in the step 4. And finally, we have one more step, and that is going to be the step 5 itself. So as I told you, the best place for the woman to test herself, to examine herself, is in front of the complete full mirror, and it has to be in front of the she should be standing in front of the mirror. And best time is after taking bath when the body is wet. So because the simple thing is, the firmer will be the hand, and the palpability of this particular gland or the lump can be felt by the hands or the areas of this particular hand tips. So that is going to be the step number 5. Now, as I told you already, these examinations, they seem simple, but they need to be followed as a ritual stepwise. So what I'm going to do, hands down, what I'm going to observe, what I'm going to sense. One is observe, see, sign. One is touch, feel, symptom, right? The third one is what exactly is being evident, whether any discharge. That's going to be the third one. Fourth one is by lying down and then trying to find out what exactly am I feeling from the circular type of the rotations, what I'm doing to the breast. So these are going to be the thing. Now, last, as I told you, that history taking and the risk assessment, it becomes very, very evident for all of us whether we are coming into any particular type of the risk of the breast cancer. They are the very simple question answers. After the end of this particular talk today evening, late evening, I'm going to forward this form also to Dr. Sapna. I will forward one of the risk assessment scale as well. We use some standard scales by which we will come to know that whether the person is coming into the risk. It is not to alarm you, it is not to scare you, it is just to make you aware of yourself and your loved ones, maybe your mother, maybe your close relations in the family, maybe your friends. It's very important for us to know that whether we are able to do examination of ourselves, first thing. Second one, whether we are having any risk factors by ourselves. Third one, by assessing these particular risk factors and grading them into a particular scale, whether in that particular grading, whether my body is coming into risk. So this is very important for us to know, and that is what is the objective of your breast cancer awareness program or awareness event, that you should know, you should learn, and at the same time, you should be able to spread this particular type of the awareness. And these awareness are going to be in the scientific manner by actually filling these particular important type of the questionnaires. So this is the history, history form of breast cancer risk, and this is the risk assessment scale. This is what I told you. Now there are some kind of the points which you can see at the right hand side. So there are some parameters given in the left hand side and the points that are graded on the right hand side. And when we start ticking up, depending upon our family situation, our own situation, then there is a scoring which is given at the end of it, by which we come to know whether the person is coming into low, intermediate or high risk, and whether the person is should be going to which type of the specialization. For example, if the score is low, then your level of risk is low. Then breast examination, you should do it monthly. Breast specialist, you should be meeting at least once in a year. And mammography, no, you are not supposed to do even if you are coming at the low risk of it. Similarly, if you come into intermediate, if you come into high, then your screenings will become more and more intense. Your visit to the clinics will become not very frequent, but at least once or twice in a year. And definitely, if you're coming to the age of 40 to 70 years, then definitely mammography has to be done in such type of the patients. So this is what the Rojon's breast cancer screening recommendations is used. This is used not only in our cancer clinic and in our own hospital, but also it is supposedly be a most easier kind of the risk assessment scale what we people have been using with. So as I have already told you regarding this signs and symptoms. Now one thing which I would like to tell you that the outcome of it is not really very shady. It is really hopeful, because there are so many types of the developments that has been taking place. So we have surgery, chemotherapy, radiation, targeted therapy, and hormonal therapy. Now let's understand one more thing, that is the artificial breast. So there are patients whom we have seen in our own risk assessment from last 2 years. I have seen one patient who actually got into the risk according to our assessment. She was referred to the breast clinic, and then from the breast clinic, we got to know that she has already entered into stage 1 type of the cancer. Then immediately it was removal of the left breast, it was actually cancerous, and then there was this development of the prostate breast. So this, after that, every year she needs to undergo a particular PET scan. This has been 3rd year consecutively, and she's been leading a normal life. So this is the message: the earlier, the better. You should know that it has got to be early, so that the rebuilding of this particular type of the disease to the normalcy is going to get it closer for us. So these were the myths and the facts. I have already told you certain things about it, that whether the volume of the breast has got to do something with it, whether the use of the perfumes or the antiperspirants below the armpits, whether that is causing you any risk. No, nothing of that sort. Actually, there is no scientific evidence. But only one thing we have to understand: any chemical, no matter how actually good it is to the body, but any chemical, it is actually trivial that it may cause some harm to the body, because after all it's a chemical. And then the adulterations and anything of this will put the body more into the risk. So better any chemical do not get directly to the skin exposure. Better to be putting all that on the clothes itself. There was one more very interesting question in our previous breast cancer awareness. There were people who asked that wearing the bra, has it got anything to do with this particular kind of the prevention of the breast cancer? Actually, nothing of that sort. But of course, the proper size and proper this thing, that is mandatory. So other than that, there was even thing like night, whether if I wear bra and if I sleep, then will I get into risk of cancer and vice versa? No, there is no evidence of that sort, that it has got anything to do with the wearing of the bra, until unless it is not really very congested and compacted with the tight kind of the clothing. Rest, it has got nothing to do with the bra wearing during the nights and the incidence of the breast cancer. So that is one of the myths actually I had to say. These are some of the wonderful faces in front of you. You have the wide range of these populations whom you can see. Some of your own very famous and liked celebrities. They all had been diagnosed. They all have fought this particular disease very, very bravely. Even after, getting into the 2nd or the 3rd stage, I wouldn't like to take the examples of such big shots or such VIPs who could get to some restricted kind of the treatments abroad from the US, which may not be the reach to all the common man or from Indian population. But still, there is always a hope that earlier the better, and we will be able to prevent this particular type of the disease. This is one last thing: genetic testing is there, but I think that I've taken a lot of time of yours, so I think that I'll be able to close it now. So this was what exactly the message was: to do those simple things in the routine and adapt to these particular simple things. The way like we visit salons twice a month, thrice a month, maybe once a week. We have so many type of things which we follow for our own physical appearance. Why not do things? Take things very seriously which are necessary for our own body, because women is the most beautiful thing, and women is the most beautiful creature of the God. This is what I feel, and I think we should actually appreciate it, and we should be proud of being women, but not only women, healthy women. This is what I would like to say in the last, and thank you very much for your patient listening.
Thank you so much, ma'am, for that wonderful presentation. It was elaborate and yet simple and easy to understand for everyone. You even included the self-examination of breast. That is really helpful for all of the girls out there and women out there. Thank you so much, ma'am. And anybody have any questions to ask, please? If you have anything to ask, ma'am, you can ask now.
Ma'am had covered almost everything.
Yes,
Usually, I used to come up with some questions, but this time, ma'am had covered everything. No more questions to ask. We have all the answers.
Madam, I'm extremely impressed by you, and that's the reason why I would like to get connected more further with you. So today I will be sending you one questionnaire, ma'am, which is actually this is a type of a questionnaire in which you being a woman, what you should be knowing regarding the breast cancer, not only regarding its prevention, its identification, its everything about it, even including the treatment options and the outcomes. So I will be sending that Google form to all of you, and I will appreciate your filling it up and then sending it back to me. This is for your self awareness, and even it will let you know where actually you should try to know more, which is the information which you try to know more. So that is very important. So it's all a scientific presentation, which is that particular Google form of mine has. So I will send it to you, and Dr. Sapna can circulate that to all of you for you to fill it.
Yes, sure.
Thank you. Anybody has any questions? If not, can we move forward? Yes, now I request Dr. Chitra, a member of our Women Empowerment Cell, to officially deliver the vote of thanks. Over to you, ma'am.
Good evening. Good evening. Am I audible?
Yes, you are, ma'am.
Yeah, good evening, everyone. First of all, I would like to thank our participants. It crossed around 117. Thanks to all the delegates, our students, faculties, HODs who participated and motivated our session. And I'm very happy that male faculties were there, male students were there who were participating. That is like a very overwhelming response. And thank you so much for that. And now comes like our speaker, ma'am has covered the session so well, and Sapna ma'am wouldn't have got a better option than ma'am for this such a kind of talk. And ma'am is so experienced in the field, as well as ma'am has given us the preventive measures, as well as how to examine every point she has covered. So thank you so much, ma'am. Thank you, Dr. ASAVARI Raut, for such a wonderful session. And we would like to have more sessions with you, ma'am, in the future. We will contact through Sapna, ma'am, again. Thank you so much, ma'am. And
Sure.
I would like to thank our principal, ma'am, our vice chairperson, Samira, ma'am, and all the faculties, especially the HODs who were present, like Dr. Gigi, Dr. Sahir, all of the Rahmat, ma'am, then other faculties like Manju, and other people were there. If I have missed out anyone, pardon me. Thank you so much for all your presence and all everyone, especially my students, our students who participated. Like after their college session, they sat for this, and it was like it is not. It is very useful session. It was very useful session that we could give to them. Thank you so much, everyone, and good night.
Thank you, and I especially thank you people for getting my name right. Whenever usually I talk to the people outside Maharashtra and Karnataka, it is how they spell my name, because it's a very classic Maharashtrian name. So thank you very much, Dr. Chitra, and I'm sorry again I forgot your name.
Dr. Shruti, ma'am.
Shruti, yes, Shruti. Thank you so much, both of you.
Yes, one more time, Dr. Shruti, thank you so much for that wonderful hosting. It was really good. Thank you, Shruti, and thank you, Sapna ma'am. Special thanks to Sapna ma'am and all the members of Women Empowerment Cell. And in name of Women Empowerment Cell, I am thanking each and everyone. Thank you.
Principal ma'am, if you could give me permission, can I leave the meeting?
Yes, sure, ma'am. Sure.
Thank you so much.
Thank
Very
you
nice
so
meeting
much,
you.
ma'am.
Thank you. Thank you so much, madam. Nice meeting you.
Thank you all. Thank you.
Thank you. Good night.
Yes,
Good
good
night.
night. Good night. Good night, Dr. Sapna.
Thank you so
Good
much.
night. Thank you so much, ASAVARI. Thank you.
Thank you. Thank you. Thank you.
Good night.
Thus, we have come to our end of our presentation, and now thank you everyone who has participated in this and made this into a great success. Thank you, everyone. And good night, all.
Great
Good night.
participation from students.
Yes, yes.
It was superb.
Oh, Neil as well. Great.
Yes, ma'am. Yes.
Thank you.
Okay.
Oh,
Thank you
huh.
so much. Bye.
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 Good night. Good night.
Good night.
Good night. Good night.
Night, ma'am. Good night, ma'am.
Good
Thank you, ma'am.
night.